We frame today's recommendations by looking at specific domains from the themes you identified and offer the national leading practices in that area, what DDS is currently doing in that area, and next steps for the future. In the area of access, we will review workforce strategies, information and assistance, and stakeholder engagement. Our national scan tells us that workforce strategies are addressed through increased rates, ongoing training for direct support professionals, DSPs, embracing and utilizing technology, creating paid family caregiver opportunities, and having the community understand what an important role DSPs contribute to the system. Current practices include in 2022, DDS providers received a historic 25% rate increase. DDS offers incentives to case managers for timely reporting, and has also expanded the use of self-directed services, remote supports, and enabling technology to help address the workforce shortage. For next steps, DDS will look for ways that rates support service modernization efforts. DDS will explore expanding paid family caregiver, legally responsible individual options for adults and minor children. DDS will also conduct data collection and analysis of the direct support staffing capacity issues and vacancy rates so they can plan for the future. DDS is releasing a targeted recruitment campaign for the developmental disabilities workforce for state employment, direct support professionals, behavior analysts, allied therapists, and other professionals who are essential to the workforce. For information and assistance, national practices focus on websites being accessible and shared referrals between systems. DDS is working on ways to make information easier to understand and access. Additional current approaches include resource navigation efforts. They have a strong partnership with Liberty, who assesses families' needs and connects them to resources throughout the state and assists them with waiver enrollment. This has created improved timelines for accessing services. DDS also offers quarterly regional family meetings to help introduce waitlist families to DDS services and supports. Additionally, DDS hosts two-day Wellspring events for families who are currently receiving waiver services to help connect them with resources and to foster family mentorship. The DDS website has been upgraded to offer multiple ways to receive information, including short videos and infographics. The website offers translation of its content into multiple languages. You're going to start seeing more cultural representation in DDS materials and on the website, so everyone who seeks DDS out for information sees themselves represented. You will also see an increased collaboration with state partners to help make sure that no matter where someone comes into the system, that they get access and connected to the resources available to them. Nationally, stakeholder engagement efforts highlight success with cross-disability partnerships and planning advisory groups. Currently, DDS hosts routinely scheduled provider meetings to share the latest information and keep providers up to date. Additionally, with the assistance of Candor and Public Strategies, DDS has improved communication and outreach with person-supported and families. For next steps around stakeholder engagement, DDS is going to create a cross-disability advisory committee to help guide and implement services and supports to modernize the system. This cross-disability advisory committee will include individuals and families with lived experience who will help guide the ongoing modernization efforts of DDS. DDS is also creating several opportunities for stakeholder groups to help us in our transformation efforts, starting with healthcare coordination and quality. For building on strengths and creating opportunities in services, DDS will focus on self-directed services, competitive integrated employment, crisis services, residential supports, and healthcare coordination. Our national scan tells us best practices for self-directed services involve peer support opportunities, increased training, and plain language information to help families understand and navigate self-direction and what it means. Current approaches include creating Spanish versions of all self-directed forms, resource materials, and training content. DDS offers a 90-day intensive support for new employers of records, EORs, offered by Acumen. There are weekly in-person open door opportunities for employers of record in Tulsa and Oklahoma City, where EORs are provided with one-on-one assistance through the enrollment process. Additional strategies include ongoing training supports for employers of record, the creation of a self-directed services instructional booklet, universally designed, easy-to-understand materials, and a family resource navigator for self-directed services. For next steps in self-directed services, DDS is in the process of creating an online searchable self-directed services goods and services vendor directory. They're also going to establish self-directed options for transportation, pre-vocation, and person-centered facilitation services, and are going to explore adding a support broker service. Finally, DDS is creating a survey to measure the impact of self-directed services on people-supported EORs and self-directed services HTS. For competitive integrated employment, CIE, leading practices show strong interagency partnerships are essential, and providers are redesigning business models away from sub-minimum wage. Value-based payments and paying for performance are leading practices, while expanding transportation resources, supporting self-employment, and micro-enterprising, as well as utilizing technology, are leading efforts. DDS is committed to everyone having employment opportunities. Currently, DDS is collaborating with the Department of Rehabilitation Services, DRS, on an employment pilot where they are examining best methods for sequencing their services so there is no gap in support. DDS has quality payment options available to employment providers and also encourages providers to consider remote supports and enabling technology as a support option in employment settings to increase independence in the workplace. The next steps around competitive integrated employment include analyzing the trends, experiences, and outcomes of the existing quality payments and expanding their options and reach in the DDS network. DDS is looking at ways to expand benefits counseling. They're going to modify current policy to promote self-employment and work-from-home opportunities for people with disabilities. DDS will also build upon existing relationships with DRS and the school system to improve transition planning and outcomes. Continuing with services, National Best Practices for Crisis Intervention demonstrates a care continuum that includes mobile crisis response, stabilization, and out-of-home placements when necessary. Currently in Oklahoma, the service delivery system is strengthened through collaboration among DDS, child welfare, and providers during crisis situations. For next steps in crisis services, DDS plans to develop a formal crisis intervention plan by assessing strategies, experiences, and barriers, which will lead to developing a crisis continuum and therapeutic stabilization options. This may include the development of an internal team to further support crisis planning and stabilization. For residential supports, best practices focus on home and community-based services, HCBS settings compliance, and shared support models, including shared living. Current approaches for residential supports include embracing technology as a solution to increase independence and autonomy, as reflected in Oklahoma's Technology First commitment. DDS has smart home demonstration sites available to educate providers, families, people supported, and DDS staff about enabling technologies and how they can be used to support people with disabilities. Remote supports and enabling technologies are increasingly utilized in the system. For residential supports next steps, DDS is exploring options for improving the availability of HTS for those receiving in-home supports. DDS is also looking at ways to expand respite, paid family caregiving, and shared living options. DDS will be exploring partnering with the Housing Authority to increase capacity for affordable, accessible housing. DDS is also researching rideshare transportation options for work and community inclusion. Finally, they're finding ways to incentivize transitions into independent living through quality payments to providers. Nationally, healthcare coordination highlights person-centeredness, using technology to increase independence, and disability-competent care coordination that is rooted in understanding each person's disability in the context of their healthcare needs. Examples include someone to help ensure each of your medical providers are aware of your other existing medical needs, or someone to help make sure you get to your appointments. Healthcare coordination is currently offered primarily to those who receive residential supports. As a next step, DDS is going to expand access to healthcare coordination as a waiver service available to people in non-residential placements. For building on strengths and creating opportunities in quality, we will focus on data transparency, quality metrics, and training. Our national scan tells us best practices in data transparency involve accessible results being shared on websites. Currently, DDS has several ways to track compliance and quality and to share information with stakeholders. Each year, individuals receiving services participate in the Oklahoma AIM and National Core Indicator surveys, while a provider network participates in the National Staff Stability Survey. The DDS website includes progress reporting on the elimination of the waitlist. For next steps, DDS is committed to increasing the quality of services available. Next steps focus on sharing the results of the data that's being collected on the website. Nationally, quality metrics involve ongoing assessment of person-centered quality services with standardized measures. Currently, provider quality assurance reviews are conducted annually to ensure compliance with health and safety measures and HCBS compliance requirements. DDS continues to find ways to track trends and identify root causes. DDS does this through our incident and mortality review committees in close collaboration and partnership with our providers. The next steps include fully analyzing the data collected for trends and ongoing improvement opportunities. DDS's goal for data-driven decisions aligns with quality services of tomorrow. Best practices in quality training involve comprehensive standardized training available to all caregivers. Current training initiatives focus on evidence-based trainings, which assess competency of learners. DDS is committed to continuous improvement and is currently conducting a review of the trainings offered to DSPs to eliminate outdated or redundant content. DDS also has targeted trainings for case managers through a mentoring program, training academy, and quality assurance initiatives. For next steps, training efforts will focus on increasing access to comprehensive, competency-based training for all caregivers, including family members and those in self-directed services. Special attention will be given to training on quality assurance, using data to improve services for people. DDS is also working to allow providers to train physical management courses in lieu of DDS staff providing the training.